Maybe we can make it bigger on that.
Nobody else wanted to, and I'm like, okay, well, I'm gonna know what the fees are, so, I'd like to have a list of the fees. Not necessarily agreeing to do that, but.
I was going to try to get the scores summarized after the roundtable, but I was done.
I know.
It was a long day.
I felt
They
like
already
a pile
had
of
it on
mushes.
the news. They'll review it last night. Well, I thought it's live.
That's a really good description.
That
yeah.
was right where my brain was. I think I sent Bob an email and that was all I did. Well, I had such a long day. I had been at school starting at 8.
Yeah, I saw you just said that. You sent me a note.
All day long, And at 9:02,
I was hoping one channel.
and I actually had to
Sometimes Fox is
shut off
pretty
my
good
camera
about
because I
coming
wanted to send you an email.
Whoever, no matter.
I thought,
Sorry,
that
I
doesn't
was
look good to be
actually-
doing that on
Yeah, I
camera,
was
so I cut off
actually
my
using-
camera for a few minutes.
I was using my
Realized the
iPad,
two
so I
stations
didn't
were
get
joined
it.
together. So I'm sure
This was
it's
sitting
on
upstairs charging.
Yeah, one too. So that's great. Yeah. Different audience.
I haven't had many interactions, but reputation and then the ones I did, I was like, Well, here we are. My computer says 8:31.
And we are live on the.
The clock, and we're live, and the clock says something else, but we'll go with both the live and the computer clock. And we're all here, so hey.
8:29. What's the minute or so doesn't matter.
All right, good morning, everyone.
Good morning.
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 Welcome to the Cook County Public Health and Human Services Board on Tuesday, March 15th at 8:30 a.m. I'd like to call the meeting to order. First thing is the approval of the consent agenda, which includes our meeting agenda and the minutes. Is there anything anyone would like to pull and discuss? Commissioner Hawkins.
I would like to pull F, please.
All right. And let's see, maybe we'll move that down to Director's Report. That's okay with you, Allison? Yep. And then I'd entertain a motion to approve the consent agenda as amended.
I'll make that motion.
Thank you, Commissioner Hawkins. We have a motion. Is there support?
I'll support.
Thank you, Commissioner Svaleson. Motion and support. Any further discussion? All in favor?
Aye.
Hi.
Opposed? Motion passes unanimously. Thank you very much. That moves us down to our proclamations. And one thing that I think I'll ask to change on those before we even go is instead of proclaiming I as chair, I would like to proclaim we as a board. And so I'll try to ad-lib that if I can remember after I read through them. We have two here, A and B. A is recognizing March, which we're well into as Social Work Month. And then B is recognizing April as Child Abuse Prevention Month. And so I'll just take a moment and read through each and then ask for approval from the board on those too. All right, starting with Social Work Month for March. Whereas the social work profession for decades has been dedicated to improving human well-being and enhancing the basic needs of all people, especially the most vulnerable among us, particularly during the global pandemic. Whereas this year's Social Work Month theme, "The Time is Right for Social Work," embodies how social workers rose to meet the most pressing challenges of all of our lifetimes, the COVID-19 pandemic, even as our nation continues to grapple with systemic racism, economic inequality, global warming, and other crises. Whereas social workers are the largest group of mental health care providers in the United States and work daily to help people, whether in person or remotely, overcome substance use disorders and mental illnesses such as depression and anxiety. Whereas social workers have always helped people overcome issues such as death and grief, and help people and communities recover from increasing natural disasters such as fires, hurricanes, and earthquakes brought on by climate change. Whereas social workers have helped this nation live up to its values by successfully advocating for equal rights for all, including Black, Indigenous, peoples of color, those who are LGBTQA, religious groups, and others. Whereas social work profession is one of the fastest growing careers in the United States, with more than 715,000 social workers today and nearly 800,000 professionals expected to be employed as social workers by 2028. Whereas social workers have continued to push for changes that have made our society a better place to live, including a livable wage, improved workplace safety, and social safety net programs that help ameliorate poverty, hunger, and homelessness. Whereas social workers possess the necessary expertise to assist our nation in some of its most demanding concerns, including their health and well-being, not only during the pandemic, but at all times, ensuring equal rights, improved health care, and mental health care for all, and immigration reform. Whereas social workers work in all facets of our society to meet people no matter their circumstance and empower them to live to their fullest potential. Now, therefore, in recognition of the numerous contributions made by social workers in Cook County, we, the Cook County Public Health and Human Services Board, proclaim the month of March 2022 as National Social Work Month and call upon all county citizens to join the National Association of Social Workers in the Cook County Public Health and Human Service Board in celebration and support of the social work profession and social workers of Cook County.
Mr. Chair, I move to approve this resolution.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Support.
Thank you, Rana. Motion and support. Any further discussion? Just want to give another thanks to our social workers and for all that you do. All in favor?
Aye.
Aye. Opposed? Motion passes unanimously. I'd also just like to give a round of applause for the social workers in the room. We'll move on to 3B. That is the upcoming month now, April, for Child Abuse Prevention Month in Cook County. Whereas child abuse and neglect is a serious problem affecting every segment of our community, and finding solutions requires input and action from everyone. And whereas in 2021 there were 94 child protection intake reports made to Cook County Public Health and Human Services. And whereas our children are most valuable resources and will shape the future of Cook County. And whereas protective factors are conditions that reduce or eliminate risk and promote the social, emotional, and developmental well-being of children. And whereas effective child abuse prevention activities succeed because of their partnerships created between families, child welfare professionals, education, health and community, and faith-based organizations, businesses, law enforcement agencies, and the business community. And whereas communities must make every effort to promote family-serving, youth-focused prevention programs and activities that create strong and thriving children and families. And whereas we acknowledge that we must work together as a community to increase awareness about child abuse and contribute to promote the social and emotional well-being of children and families in a safe, stable, and nurturing environment. And whereas all citizens need to be more aware of child abuse and neglect and its prevention within the community and be involved in supporting parents to raise their children in a safe, nurturing society. And whereas prevention remains the best defense for our children, families, and communities. Now therefore, we, the Cook County Public Health and Human Services Board, do hereby proclaim April 2022 as Child Abuse Prevention Month in Cook County and call upon all citizens to recognize this month by dedicating ourselves to the task of improving the quality of life for children and families, thereby strengthening the communities in which we live. Would anyone like to make a motion?
Mr. Chair,
Commissioner Sullivan.
I'd like to move to accept this resolution.
Thank you, Commissioner Sullivan. Is there support?
I'll second.
Thank you, Pat. We have a motion and support. Any further discussion? All in favor?
Aye.
Aye. Any opposed? Motion passes unanimously. Very good. That moves us on to item 4, staff report. And this morning we have Grace and Heidi here.
Good morning.
Good morning.
So today we're going to talk about child protection services in Cook County, and I'm the supervisor for the team. I was just thinking as we were reading the proclamation, 15 years ago is when I started, and how we do things is quite a bit different than how we do things today. The volume is so much greater, and so many more rules and laws have passed, and so there's been a lot of changes in how we do our services. And I'm so grateful to have Heidi here. Heidi has worked with our agency for many years, and she is currently enrolled at the University of Minnesota in an MSW, Master's in Social Work program, as a 4E scholar. 4E scholars are specifically trained in areas of child protection, prevention of child maltreatment, and so she brings so much expertise to our organization, so I really want to thank her for pursuing that and bringing all that great information to us. So we are going to talk about child protection services. First of all, the reason we do child protection services is because it's mandated by law. Just in this last legislative session, the chapter, how all law, child protection work is organized has changed in statute. It used to be Minnesota Statute 626556, but now it is all organized under Chapter 260. And so that's why we do the work, and we follow the rules and guidelines, because when we enter in that world of child protection, we are using laws and rules and government to become involved in people's lives, and that's a really big deal. I was had a training earlier this year, and a fellow supervisor in another county said when she talks to the people that she works with, she says, when you knock on that door for that family to talk to them about the situation today, you are forever changing their life. So I want to say that we carry that same attitude. We're very mindful about the power of the law and our role, and how to work with the rules in the kindest, most facilitative manner possible. The guidelines articulate 6 areas of maltreatment: substantial child endangerment, sexual abuse, neglect, physical abuse, mental injury, and threatened injury. And the guidelines are about 100 pages long, and each allegation organization has multiple pages of specific types of things to look for, examples, but there's also nuances in all that we look at. So we have, there's a lot of information there. We pull out the guidelines for every time a report comes in. We do not make any decisions off the cuff. We say statutorily, how does this work? So we take our job really seriously in making sure that what we decide is in alignment with the statute and the guidelines from the state of Minnesota. So how do we get reports? Well, we get reports from all those friendly faces you see up there. We get them from the clinic, from school, law enforcement, child care providers, and we also get reports from the community. Reports can be received in any manner or form: phone, they can be anonymous. We've had people drop letters in our drop box outside the courthouse, and we treat anonymous reports in the same manner as we treat face-to-face verbal report, because somebody's raising a concern, and we take it seriously. I think the anonymous reports are few, but in a small community like this, people get nervous about sharing information. So I just am so happy. That's a change in the last couple of years. I think anonymous reports were determined to be less valid in the past, but now we treat them with the same validity as if it's a face-to-face or we know the reporter. The people on the list here, though, the pictures that you have, they're all mandated reporters, and so by law they have to report, and they're required to make verbal reports within 24 hours and written reports within 72 hours. We accept the reports by fax or email or written paper forms, and the reports can go to law enforcement or our agency. We cross-report with law enforcement so that we make sure that we're working together in a collaborative way. So this diagram shows the pathway that we take. There's the intake, screening. Screening is a word that we use a lot, and that is the process where you look at all the information that comes in, you look at the guidelines, review the statute. One thing we like to do is say, well, is this similar to any other family we've worked with? How do we respond to that family? Is this similar or different? We're really trying to analyze the situation to make sure that our responses are consistent and thoughtful for the need that's presenting. As you can see, we need to receive the reports within 24 hours. If you all were to make a report, you'd need to make that report within 24 hours of gaining the information. We need to screen that report within 24 hours of receiving it. And we follow those timelines very accurately. We've done really great. The state watches us to make sure that we respond in a timely manner, and we're always very, very high in that area. And that includes weekends as well, so we are available 24/7 to respond to maltreatment reports when we receive them over the weekend. And let's see, what happens after that? Well, it depends on what pathway we follow. Either report meets criteria, it's screened in, which is our lingo for a screened in maltreatment report, or it's screened out. But either way, whether it meets guidelines or not, we have the flexibility to call that family and say, hey, it sounds like you had a rough night, or sounds like things are complicated right now, wondering if you'd like any help. And we offer assistance a lot because we know how hard it is to raise kids. We know all the variables, and we know how important it is to connect people up with resources, and what a mirage it can be to think you know what resource you're going for, and it's not there when you want it. So we really like to help families, and we know families are so busy working full-time, raising kids, traveling. So we like to be very helpful in any way we can. So again, what do? And when it's a screened-in report, we meet with the child within the 24-hour period of time, or within a certain period of time. If it's what we call egregious harm, an investigative report, we meet within 24 hours of getting the report. If it's what we call a concern, it screens in for what we say an assessment. Like, there's concerns here, it meets criteria, but it doesn't meet guidelines for egregious concerns. Then we can meet with the family within 5 days. So we have a little bit of flexibility there. We like to meet with the child, find out how things are going, what's going on. We like to be able to meet with the caregiver and let the caregiver know we're going to talk to the child. Sometimes that's tricky, and we understand that. So it just depends. We really, really look at where are we going with this report and what are our concerns. We also meet with the caregiver, and we know that when a family gets a call from Child Protection, it's nobody's best day. It is not a fun day to get a call from Child Protection worker. And I want to say, for us, it's not easy either. It's hard to, we care about the families we're working with, we care about the parents, we care about the kids. So it's we're all coming together in a really, really complicated time to see if we can shift the way things are going. But it is nobody's best day when they get a call from Child Protection, even though we work really, really hard to be sensitive and thoughtful. So we work with the family to address concerns and such, and we always let the family guide us and find out what's going well in your family, how are things, and how can we build on that, or if things, or we'll ask, when are the times when things have gone the best? Well, maybe they were best when, my mom lived next door and she could watch the kids for me. Well, okay, so we understand there's been a change and we can learn from that. But we try to replicate times when things have gone well. We try to build on strengths and work on affirming that parents are doing many, many things right despite the concerns that were presented. No family has everything all wrong, and so we really want to build on strength. Sometimes, though, things are too unsafe, and we can't achieve safety, and so we have to consider placing the child outside the home until we can achieve safety. And that becomes even, again, further nobody's favorite day. But yet we work with the family to determine where would they like the child to go. We always want to place kids with somebody they know, just like any of us. We wouldn't want to go to a stranger's house if we didn't have to. We would like to go to a friend or a family where we feel safe and help build strengths in that way. When we don't have family resources, we have some licensed foster care providers in the community, and the children go there. And there's two pathways for that. Parents can voluntarily place their kids. We can say, look, here's an example. Like if you went into a home and you found that it needed a good cleaning. There's broken glass. Pets haven't been outside for a while. Food's not looking good. The house needs a deep cleaning. Child can't return home. That's the parent. If we walk through things with parents, a lot of times they'll say, yeah, it's okay. They can go to my mom's until I get this figured out, or they can go to their friends until we get this figured out. The parents can sign what's called the Voluntary Placement Agreement, and so it's very transparent. The parents still have custody of the children. We're just working on solving the problem, and so we can return the child to home. When there's a situation where it's not voluntary, we work with law enforcement collaboratively to take the children into emergency protective care. And that only law enforcement can make that decision to take a child into emergency protective care. And that is a very serious situation, and a lot of times the children need to be removed immediately, and it's very hard to coordinate with the family in those situations to find family members to place the children at. So a lot of times we use our licensed foster care. We just suddenly had a situation like that last weekend. We've done multiple situations where children have been taken into emergency protective care over the last several months. And so those are really intensive in a lot of ways. It involves law enforcement, a consult, not just with the deputy, but a lot of times with the chief deputy. It involves the foster care parents. It involves our fiscal side, because they have to decide about payments for the foster care parents. It involves the court admin, county attorney's office, attorneys from the various entities that we're working with. So it becomes very labor intensive when we don't provide services, when we find out about things suddenly, or we can't provide services earlier. I just want to share with you, Heidi and I are going to share with you a little bit of information about two important aspects of our work that we need to consider as well when we're doing our work, and that's one is the Indian Child Welfare Act, which we refer to as ICWA. That law was passed in
1972.
Eight.
So not that long ago.
Not that long ago. Mm-hmm. And ICWA is a really important act for all of us. It just really talks about the importance of family and maintaining family. And I'll let Heidi talk a little bit about that. I think you have a lot of experience with that with your 4E work. So
yes. So the spirit of ICWA is to keep Indian families together. So one of the processes that we use in our county is that we screen all reports related to any children that either live on the reservation in Grand Portage or we have reason to believe are affiliated. We screen all of those reports with Grand Portage, and we've really built that relationship, and it means a lot to us as an agency, and we really want to foster that relationship as much as we can. So related to, so that's one of the processes that we do as a county that not every county does to make sure that we're following the spirit of ICWA. So ICWA was passed in 1978 due to the heinous removal of children and boarding schools that occurred then for hundreds of years prior. And so we're still all recovering from that as both being in a government agency who was responsible for much of that, and then also, more importantly, the historical trauma of American Indian people. So because of that, we are required by law to always try to keep Indian families together. And if we're unable to do that with parents, then we find kin or other relatives, preferably close to home, they're enrolled or eligible for enrollment tribe. So also as an agency, we really like the spirit of ICWA for all families. So we do try to make that priority across the board for everyone, like Grace was talking about, how we always try to place with friends or family. But through ICWA, we're required by law to do that. So it is something that also creates extra paperwork on our end, which is important and provides some communication across the board. So if we have a child who is in court and they are eligible for enrollment or enrolled in a federally recognized tribe, we send extra notices to that tribe so that they can be involved in that court proceeding. And we are also required to document our active efforts, which is kind of like the gold standard of trying to go above and beyond to help parents succeed, which again is why we really like ICWA and we really want to do that for all parents, because especially in a small county, we have some capability of doing that. We have, depth of staff and expertise in how to make that work for families. So, did I miss anything on there about that? There's also the MIFBA. Did you want me to talk a little bit about MIFBA? So in Minnesota, we also have a MIFBA, which stands for Minnesota Indian Family Preservation Act. So then we have requirements through the state of Minnesota to basically bolster the ICWA Act and do notices to tribes even when we're not in a court hearing. So if we are doing any sort of voluntary service with a family or there's a screened-in child protection report, we're required to let the tribe that they're affiliated with know. And we're required to do that anytime we start working with a family. So even if last year we worked with the family voluntarily for something, we closed and then we opened again, we're required to let every tribe that could be affiliated with that child know because of eligibility requirements changing among tribes. It is only required for federally recognized tribes, so not First Nations, but we do try to make efforts to connect with tribes if people are affiliated with them.
For people in federally recognized tribes, the rules do change about enrollment, and so it's just very important not to participate in the erosion of any of the rules or laws that affiliate a person with their tribe. So that's why we're really take it seriously and follow through on that. And again, that's another thing that we are audited on a regular basis to make sure that we're following all those rules. So ICWA has been a really great thing. We're so fortunate to have the opportunity to work with the tribe. We've learned so much, and the tribal attorney is Jessica Ryan, and she's been a fantastic partner for us. And we just just really thankful for the relationships that we've developed over the years.
Yeah, she's a wonderful advocate for families.
Yes.
Mm-hmm.
The other tool in our toolbox that's really important, that requires a really high level of training and expertise, is forensic interviewing. Forensic interviewing is a skill in which you gather information in a really objective manner without leading a child. Again, back in the 70s, there was a very significant sexual abuse allegation in a large group of, in a small community in southern Minnesota, and an attorney got involved and re-interviewed children. There was a lot of concern about false memories and prosecution, and it became really complicated. And as a result, a lot of research started to be developed on what are the best ways to interview children. Of course, this wasn't just happening in Minnesota, it was happening nationally too. And so there was a lot of research developed on how to interview children well, how to gather information in a way that stands up forensically in the court so that we can prosecute people who are causing harm. And So forensic interviewing is almost everybody in our on our team who works with children is trained in that. The training is offered through First Witness, which is a child advocacy center in Duluth, and that's all they do there is forensic interviews. And talk about a wonderful partner. Oh my gosh, they're amazing, so helpful to us. But again, when we move to that level of forensic interviewing, and that's almost always when we believe a crime has been committed, so those egregious harms, sexual abuse, physical abuse where there's injuries and marks left, other significant forms of injury where there could be criminal charges. When we move to that forensic interviewing component, we are involving attorneys, law enforcement, First Witness. Currently, we have some technical problems, and of course it's been COVID, so we haven't been conducting interviews here. So we have to travel to Duluth, the family has to travel to Duluth, parents have to miss work, kids have to miss school. It's a really big deal to conduct a forensic interview, yet necessary. I found this set of information, which I thought was so beautiful, when I was on a website called Zero Abuse Project, and they provide a lot of forensic interviews, and they just talk about how finding the right words is so important for the child who's experienced the harm, for we as the social workers or law enforcement or prosecutor to speak on behalf of the child, and when a child has to tell a jury this information. So I thought finding words is really what forensic interviewing is about, helping people find words, and so that we can convey the story so that there can be justice and safety for that child and other children. We've conducted a lot of forensic interviews, and we feel really, and we've facilitated them being happening in Duluth at First Witness, and we again are so thankful that we have that tool because it's resulted in criminal charges for people who have caused egregious harm to children. So, and I want to say so many thanks to Molly Hicken and Jean Munson, and previous to that, Brittany Cubes, for really being allies in child safety. Okay, I think we've covered this mostly, that we respond based on what the safety needs are. We really like to be involved with families when when there's less intensive needs, where we can just connect people with resources and help them develop relationships and problem solve. And as you can see, more intensive involves removing child, paying foster care providers, a lot of stress for the family, court involvement, deputy involvement. We had a hearing last week, Friday. There were 3 attorneys, 5 social workers. Court administration had to set up the hearing. The judge was involved. We really want to keep things down on the less intensive end if we can, but we're so glad we have the tools available to us when egregious things do happen. 2021 summary. In 2021, we had 94 child protection reports, 24 maltreatment reports. And so there could be anywhere from 1 to 3, approximately 3 children involved in those families. So if a report comes in on a family where one child has been harmed, that environment is potentially unsafe for all the children in that environment. And so we work with the whole family. So when there's 94 reports, that means, I would say it's closer to 94 families. Some of the child welfare intakes, some of the child protection reports do move into the child welfare area, but child welfare is generally kids with some mental health needs, emerging mental health needs, and then as you can see, we had 24 intakes for children's mental health specifically, and then the Parent Support Outreach Program, which is a really awesome program that Heidi, again, is involved in. That's one of her main areas, working with families where there's risk factors, and we can work on preventing things. And again, this is a voluntary program, and we really like working with people at that level. Let's see, and New things happening. The Family First Prevention Services Act passed in 2018. It's a federal law. It was implemented in Minnesota in October of 2021, and we're really just learning. It's a 5-year rollout, and so we're at the very, very beginning stage. But the goal of the Family First Prevention Services Act is to assure that children are not placed in residential treatment and away from their family, to be as prevention-oriented as possible. And we feel like that's something we understand really, really well. We're so small, we're so far away from so many resources, we have to be really creative and work on prevention services. One thing, in all the region, the small counties, they know their kids that are in treatment, and then you don't generally lose kids, but in big cities, you can imagine kids go off into residential treatment, and who knows, if their people aren't involved, and somebody isn't advocating from them, they could get lost. And so there's some unevenness on how this applies to a small county versus a large county, but we're happy to be working with it. In the future, we hope that there's some funding opportunities available for using prevention-based work, but they're still trying to figure that out, but that's okay because it's a long rollout. Do you want to say anything more about Family First?
I know that eventually the goal would be to have some funding for some of the trauma-informed services in our community, but like Grace said, it's rolling out slowly and to be continued.
Yeah.
With that, I think we're all kind of learning about what this will look like for us. So
October wasn't that far away.
No.
So we're just learning it, but working on that. And the state's doing a really good job of communicating with us. Again, we're really prevention-oriented. One thing we did, just to shift things up, is we've renamed our child protection workers. We call them family services workers because it's much nicer to get a call from Heidi at Family Services versus Heidi at Child Protection, because we've felt like when we say we're protecting your child, it right away creates a negative relationship with the family, like you are protecting your child, and they're vastly majoring protecting their child almost all the time, but something happens. So we were really happy to land on that, and so now we call our team of Family Services. We've been prevention oriented for years, and the PSOP program. We're big into acronyms in our agency. Parent Support Outreach Program. What would be a presentation without a new acronym? And so we really love that program, and that we get funding from the state, and we can use that funding to remove barriers. For example, if a family needs a fix on their car so that they can get their child to the doctor to avoid medical neglect, we can do that brake job with the funding that we get from the state. And so those are all state dollars, and we can utilize those. And it's really exciting to think that you can help a family out in that way, because sometimes unexpected issues come up, and when you can resolve them, then families can, instead of being stressed about the car, they can get the car fixed and do what they need to do and move forward. So it's a real great program. This is the attitude we have at our agency about working with families with child abuse. We can work to end it through moving the dial up, getting involved earlier with families and being more prevention-oriented, and helping families thrive. We work really collaboratively across all systems. Preventing child maltreatment really means looking at what are the factors that contribute to maltreatment, and what's making it hard for the parents and the caregivers and the adults. And it could be chemical dependency, unresolved or unaddressed mental health situations, and then the whole myriad of societal factors of underemployment, lack of child care, racism, things like that. Very stressful for families, and so just us being aware of those things really help us address the risk factors. And that is all I have. Does anybody have any questions?
Thank you. Commissioner Storlie.
Yes, thank you. Great report. Thank you for bringing us up to date with all that. I was just thinking about the Family First program. I remember that when I was going to AMC, that was one of the programs that they really have supported. And now look where we are, with support and collaborating with states and all of that. Did you say that in 2021 there were 94 family maltreatment reports? Is that an average? Was it up? Was it kind of down? What would you say
I
for
think
the numbers on that?
In 2020, we had 76
Okay.
maltreatment reports, and so then in 2021, we had 94. So whoever's real
Yeah.
quick with math can figure out what that percentage is, but it's like in the 20 percentages, you know, it's
Okay.
a pretty big increase. I think one of the variables, of course, is COVID. At first, I think last year maybe it was down a little bit because of COVID, because nobody was seeing kids. Last year, kids were coming back to school. There's a lot of adults struggling right now, and so that is rolling over into educational neglect, kids not getting to school, that kind of thing. And so, but we have never gone, I don't think we've ever gone down in the number of reports we've had. Every year they keep going up. Not by much, maybe some years, but yeah. And I do want to say I credit our ability to communicate about how to report and our, you know, great partnership with the community. That increases reports as well.
Unfortunately, it seems like when parents struggle, kids struggle, and we know we've all been struggling. So, Pat, you had your hand up.
Grace and Heidi, do you have an idea of how many hours of paperwork is involved in treating one case? Because ever since I've been here, I keep hearing that Public Health and Human Services receives all of these things they have to do, but they don't necessarily receive the money from state and federal sources to help them. So how much paperwork is involved in a case? How many numbers of hours? Just an idea.
Boy.
Because it sounds like a whole lot to me.
It is a whole lot, and it's not just one person. We team it because that's the best way to be safe with our work, you know, so.
I can speak to the intake part.
Yeah.
So one of my primary duties is to take the child protection reports. So it widely varies, which I'm sure you hear us say often, but it can be, I can be on the phone for an hour with a caller asking questions about a report. It can take me well over 2 hours just to get the documentation into the system, even though I do it all the time. We have to screen it. We've screened reports for over an hour before, and that's the whole team together. So that's, you know, 4 social workers usually. And then cross-reporting with law enforcement. And that's just figuring out what to do with the information. That doesn't include then the worker reaching out to the family, reaching out to collaterals, meeting with the child at school, potentially traveling to the West End or Grand Portage or out of county even, depending on where the reports were. So the paperwork is only a little bit of what we do, but the actual action of what it takes with just one of those reports is substantial.
I would say too, for example, with MIFPA, that's for each child too. We have, so for example, say we had a family, say there's 4 kids in the family, we have to, and they're affiliated with the tribe, we have to do the MIFPA forms. Those are a couple of hours. Each child in the family needs their own MIFPA form because each child is different. And then say we have to move on to court. Then we prepare a petition for the county attorney. Then there's regular court reports. So those can take hours because you're gathering information. You know, so the preparing the document requires gathering a lot of information.
Our social service information system has several things that need to be completed that, depending on what the nature of the report is, can take a staff, you know, half of a day to get things tidied up in there.
I would be curious to see if there's a way to measure paperwork time. I mean, I can look on SSIS to see, you see the way we enter information, if you're writing paperwork related to an individual, we tie it to the individual's work group, so we don't put it under just documentation. It could be, I'm going to look now. I'm going to see if there's a way to figure that out, because it's a really good question, because I don't want to be so like, oh, it's so much, and then, but I would like to see if I can figure that out.
Yeah.
I think that would help with understanding staffing needs a lot. A lot. Thank you.
No, that's a really good question, and I don't, it's funny the way you enter the information, it doesn't really sort the way intuitively you'd like it to sort. It's, the trouble with technology, what we want it to do and what it does.
When the old adage of an ounce of prevention, goes a long way with just the amount of workload, the more we can do for prevention, the more we can invest in prevention, it's going to help the children, it's going to help the families, but then it also helps the bottom line, just your time and expenses. Commissioner Svaleson?
Not a question, but a comment. I think the way I interpret when you say you see a little more each year coming in for reports, I don't look at that as a negative, quite frankly. You're right. I think with technology and things, there's an ability to report now that didn't exist. That's a factor of it, but I guess I choose to look at it that people report because they see that the child is getting what they need. The family and the child are getting what they need. The reports would go down if they saw that it was having a negative effect. That's how I choose to view it, and I think it's true. They see the services working. And so when there's even a question about it, they choose to report. And that's a credit to you and what you're doing. And I thank you for what you're doing, because when you protect the children, you protect the future of the entire community. So thank you.
I appreciate that perspective.
And to speak to that, when we do get reports, the people reporting often do say things like that. They say, we really want this family just to get what they need, or we really want this kiddo to just have some support. And, there's no malice behind these reports being made, and people seem to be all on that same page. So, thank you for that.
Mr. Yarkey.
Thank you, Mr. Chair. The other benefit, of course, of investing in prevention is that it helps protect our workforce. This is tremendously challenging work. And frankly, I could not do what you guys do. I can only imagine how hard it is. And I'm so grateful to you for doing it. And I hope that over time we can do a better job of investing in prevention so that our community is stronger, our kiddos are protected, and you guys have less stress in your jobs, because my hat's off to you. Thank you for doing what you do.
So I'd like to kind of pile on with that question and ask, are there any special EAP services or other kinds of services for your particular team that we offer? Because the stress and the work that you do has got to be as tough on your end as it is on the end of the people getting your help. So do we do anything special for PHSS as far as services, like mental health or whatever?
There aren't any specific programming through our current EAP provider for staff in this field. There are services offered around critical incident debrief, which we would have the opportunity to take advantage of if there were ever a near fatality or a fatality or any really negative outcome as a result of our work with families. So that is something that is available to staff. We haven't had the need to access that before, but I can say that there's absolutely a need for more support for staff who are experiencing either trauma directly or secondary trauma from their work with families. It is very difficult work.
I have to say that we have some flexibility and we're supported to take time off if we need that. So that is helpful and can really make a big difference if you can just say, it's noon, I just need to be done for the day. And we have a team that can cover for each other too, which really helps. But it's very kind of you to be thinking about that. That's very,
My hats are off to you. Good job.
In the past, we have brought in some outside facilitation support, some peer support, using grant dollars for staff. So that's something that we would have the ability to do in the future. Absolutely.
One other observation I've made is just the importance of a strong team in that support. It's not the same as EAP, and I don't want to diminish the importance of that, but just having that strong team is so helpful to be able to commiserate or process or debrief or whatever. So I really want to applaud you for that aspect too. So not only is they'll work extremely hard, but you do have a strong, healthy team to help deal with that. Yeah. Commissioner Hawkins, please.
Yeah, thank you for your work. I agree. It would be a very difficult job. I'm wondering, so the 94 families that you said you worked for this year, do you also track what the cause was for that? Whether, and do you have the breakdown of those numbers?
I don't have it handy, but
I could get, I'm just wondering, because when we're talking about prevention, where do we need to focus? Where, because there's many groups out there working on different, and it would be interesting to know, where are we lacking in our community? What services
I think
are being demonstrated that are being needed?
that's a really good point. I can say just off the top of our head that the vast majority of the reports we get are neglect, and but I will gather that information and pass it along. I think it breaks it down in how the types of, and neglect as a broad category. Lack of childcare is a very large contributor to children being left alone, especially in a tourist environment and where people work all hours, that after hours time when there's no care. It's just challenging, not just here but everywhere, but that's part of it. Ed neglect, medical neglect, not getting to the doctors, transportation to some specialty medical care is a significant barrier for a lot of people. So I think that area of neglect is...
Chronic and severe substance use also falls into that category of neglect. So there needs to be certain criteria met to screen something in for that, but that's a neglect category. And then the lowest, the smallest sliver on the pie graph would be sexual abuse. But when that does happen, it's very serious. And going back to what you were saying, Pat, there's a lot of paperwork involved in that and a lot of time. And it's also very hard to hear about things like that happening to kids and being observing those first witness interviews or interacting with the families after learning about those harms is very challenging to do. But luckily, it's the smallest percentage that we know of.
That's correct.
Yeah.
It really helps give perspective, though. Thank you for the question and just about, because childcare is at the front of all of our minds, and so looking at it through that lens, I think helps me at least.
Yes, and I think that chronic and substance misuse and pairs with mental health struggles. Sometimes people self-medicate. Chronic use of substances can lead to mental health struggles. So those two variables go together. The more resources we have to address that for the families, the better they can care for the children. I mean, you can just see how everything lines up. So, but I will look and get those details. I don't know how deep it goes, but I'll definitely get that for you. Thank you.
So if you can find anything, Grace, that talks about childcare and neglect, that would be a great piece of information to have right now as we look forward to what kind of solutions we can bring to the table in the next few months. That would be great new information to add to what all is going on right now around that.
I have some information about that.
Great.
Great.
Heidi's also our licensor,
Yeah.
and so she licenses childcare and foster care, so she knows all those many rules.
Well, luckily
Many
she's on our
rules.
committee, so yay, Heidi.
Commissioner
Being a
Sullivan.
paperwork.
So I had a question, Grace and Heidi. What type of increase are you seeing in educational neglect given COVID? I'm just really curious in that slice of it.
Well, I think one thing that makes it challenging is that it's a very stressful time for school. For school staff, they've had a lot of changes, and so I think it's and this is not meant to be a criticism at all, but it's a little unclear to know how many reports we're getting, because I think they're just really trying to reconnect with everybody, and so I think we're seeing an increase. We're seeing a lot of attentiveness to it by staff, and we really appreciate that. And maybe some unevenness in their reporting, but I wouldn't be able to put a number at it. But we're really on top of it, and we're really in communication with the school, I would say, multiple times a week about what's going on. I just don't know. Sometimes things that look bad one week start to get resolved, as time moves on. So, it's...
Yeah, and the criteria for that is 7, if you're 11 or under, 12 or under, thanks. And you miss 7 unexcused absences, so that means parents aren't calling in, then the school is required to do some mitigating with the family to see what's going on. Then after that happens, they make a report. But that doesn't include excused absences. Schools have to have their own policy about what they do with that. And so a child could miss 30 days, but if parents are calling in, it's not triggering the same way. Mm-hmm. So we have to look at that and the unexcused absences and what the school has already done. And then with COVID, we also are taking into account, like, was the child contact traced? Were they expected to do at-home learning? Is that something the family can do? Do they have internet? So we try to look at the whole picture, but it doesn't seem like it's gone up in the years since COVID. It seems still to be pretty steady, but now we just have these other factors to consider.
I think it would be great at the end of the school year to just talk about that, like what were the patterns and what did we see. And I think the school's doing a great job, and they're just really tremendous partner. So we're really thankful for all the schools and the work that they're doing. Mm-hmm. Yeah.
Thank you.
Mm-hmm.
Any other questions or comments? Allison?
I just have a comment before we transition. I just want to thank Grace and Heidi for your excellent presentation this morning. This is probably my 5th time hearing it, 5th plus time hearing it, but I'm just continually impressed by the compassion, the tact, and the integrity of this team, including Reed and Stacy, who aren't present here today but are a part of the team supporting families in Cook County and Grand Portage. So thank you both. And then a preview to our board is that next week you'll hear a year-end presentation from Lori Erickson, our fiscal supervisor, excuse me, and we'll see how our investing in prevention, our work with families up front, is continuing to have an impact on our bottom line as a department with decreased out-of-home placement costs. Thank you.
Thank you very much for being here. Thank you for your work.
Thank you. Let's see. I'm going to take this out. I'm sorry. I think I lost the agenda up there.
That's it. Don't worry.
Okay. Thank you. Thank you for your time. I know I went a little over, but it's a complex subject with when you try to combine outreach with laws that involve multiple systems, it's not an easy conversation. So thank you.
Thank you, Grace. All right, well, that moves us down to, does anyone need a break? No. All right, that moves us down to item 5 on our agenda, COVID-19 update. This may be the last update for a while, maybe. What do you think, Grace?
Well, we'll have to see. I certainly hope that I have less and less news to share with you all. It's lovely to see everyone's face this morning for the first time, I think, ever in person for one of these updates. So yeah, I do have some good news to share today. So I'll start with the case count. We're at a cumulative case count of 824. So last month, on February 15th, we were at 803. So we've had 21 cases this past month, and in the last 7 days, just 1. So we have definitely passed our peak from the Omicron surge here in Cook County. In the world of vaccination, we do see our vaccination rate continue to tick up. So we're at 82% fully vaccinated, 86% with at least one dose. This past week, the Department of Health changed that they're now reporting on people who are up to date on their vaccinations. That number is, well, it's above the state average. It's still quite a bit lower. So we're at 60.6% of Cook County up to date on their vaccinations, which means there is a relatively large number of people who are due for their booster, or if they are immune compromised, that third dose and booster. So that is now going to be a collaborative area of focus for public health and Sawtooth Mountain Clinic to really get the word out that it is very important to get that booster dose if you're due for that booster dose. It is a multi-dose vaccination series, and without having all the doses, you are not as well protected against becoming infected with COVID-19, and more importantly, from becoming seriously ill and experiencing a severe outcome from COVID-19. So we really are going to be working on trying to get those numbers up in collaboration with the clinic. At this point, we have 4 reported deaths in the county due to COVID-19. That is increased by 1 in this past month. In other updates, we are encouraging people in the community to call in those over-the-counter positives. It's still a large percentage, still over half of the positives that we have been seeing come in. So we do have stickers printed out on the over-the-counter tests we're giving out telling people, call public health with your positive result. And that gives us the opportunity to talk through isolation and quarantine, which continues to be challenging. Everyone's situation is different, so it's great to have the opportunity to talk that through. And other updates this past month with our schools. Our schools at this point are largely independent in their ability to conduct the case investigation or the contact tracing portion of things. We still do the interview with the people who've tested positive, and we remain technical assistance resource. So we're always happy to work with the school's COVID-19 coordinators on doing those contact tracing calls or helping to work through challenging situations. Both GES and ISD 166 this past month have implemented what's called a test to stay strategy. So that is a way for someone who is in school but not up to date on their vaccinations to remain in school, so they would not need to quarantine if they test regularly and wear a high quality mask such as a KN95. So they would be testing on days 1, 3, 5, and 7 after an exposure. So, but it does allow for more kids to be in school and fewer kids to be missing. So it's rather resource intensive, but the schools have processes so that the families participating in Test to Stay can call in their test results and work with the COVID-19 coordinators to try to keep more kids out of quarantine and in school. Also with schools, so Andrea Tofty continues to perform routine testing with school and childcare. She's at ISD 166 every Monday, and she's at the community center providing regular testing to employees or children in any school or childcare in the county every Wednesday afternoon. She's also organizing pop-up tests for spring break, so she'll be at the community center on Thursday the 24th of March, the 31st of March, then again on Tuesday, April 5th, offering testing to anyone in the community in an attempt to prevent any surge in cases due to travel over the spring break. So that'll just be open to anyone because, we see transmission happening within families, and so we don't want to limit those opportunities to only the school childcare community. And we're working on some promotional materials to get that out to encourage people to take advantage of those pop-up events. Vaccinations have fully transitioned to Sawtooth Mountain Clinic and are going well. I think it's really nice to be able to offer vaccinations in the context of a routine provider visit or a nurse visit. It just helps us reach more people than we were able to at the mass vaccine site, which we are now cleaning up slowly, and also preparing for the possibility of doing a under 5 vaccination effort later in the spring, depending on what the data from the CDC and FDA show. So still in a stay tuned mode with the under 5 vaccination. We also this past month changed the way that we're reporting out data on social media. So we are now reporting out our community COVID-19 level, which I'll talk more about in a minute, the percent vaccinated, which we're going to transition to percent up to date with vaccinations, since that's the direction the CDC is going, new cases in the past 7 days, and a graph that shows the case trend over the past 3 months. I'm also really excited to report that our 2 public health educators, Andrea Tofty and Andrea Orist, have the opportunity to attend the 2022 Preparedness Summit, which is through the National Association of City and County Health Officials. They have both full scholarships to attend that. It'll be an excellent opportunity to learn from peers across the country about COVID preparedness and response, and to bring those lessons learned back to Cook County. So really excited that they were both able to attend on a full scholarship. And that'll be happening the first week of April. So also this past month, while we've seen less activity locally, we have had some pretty significant national updates that do have an impact on us here in Cook County. We saw the White House put out updated national COVID-19 preparedness plan, which I can link to in my notes. Basically, the message is to maintain the tools in our toolbox. So the vaccines, the boosters, the new treatments, both antiviral treatments and monoclonal antibody treatments, testing and masking to protect against COVID-19 and reduce the risk of severe outcomes and strain on the healthcare system, and to be prepared to respond to new variants quickly in an effort to keep schools and businesses open and functional. So the 4 goals are very much the goals that we sort of align ourselves with here locally: protecting against and treating COVID-19, preparing for new variants, preventing economic and educational shutdowns. And this one, I suppose, is more in spirit than in practice here locally, but leading efforts to vaccinate the world overall. So that's a big focus nationally, is to get vaccines to other parts of the world so that we can vaccinate as many people as want the vaccine and reduce the likelihood of variants emerging in other parts of the world that would travel here and threaten the tools in our toolbox and put us back in a place where we were before we had them. So that's the update nationally on the preparedness plan. The CDC also came out with a new tool. They're reporting by county the COVID-19 community level, and it's low, medium, or high, and they're basing that on the number of people who test positive in, well, they call it a 7-day rolling case rate, but essentially it's how many people relative to your population size are testing positive in 7 days. They also are really looking on healthcare strains. So they're looking at number of new COVID-19 admissions to the hospital over a 7-day period, and the percent of staffed inpatient beds occupied by COVID-19 patients. So those 2 health system measures are regional. So they're in a region that is northeast Minnesota and even a portion of western Wisconsin. So with these, what changes, it's really the mask recommendations that have gotten the most attention. So if you're in an area of lower medium transmission, masks are considered optional. And if you get into that area of high transmission, then they do highly recommend mask use in indoor public spaces. Things that don't change: the recommendation to test if you're feeling sick, to follow isolation quarantine guidelines, to stay up to date on your vaccination. And really, I really like this tool because it's a very visual way to give the public updates on what it is we're hoping that they do relative to how much COVID is spreading and affecting the area where they live. So I liken it to the Forest Service lovely fire danger sign because it changes, it's very easy to read and understand, and I hope that it helps us move between levels as we see COVID kind of hopefully stay in that low transmission zone for quite some time. But I mean, to be realistic, I do think we'll see that change, and we'll see it continue to be dynamic over time. It's hard to accept because we want it to stay low forever, but I think being realistic, we have to expect that there'll be some changes over time, even though we are hoping that it stays low for a good long time now. So what's next? We're going to continue to stay attentive to the situation as it evolves. We continue to have frequent meetings with the states about the COVID-19 situation and gather information that we can use and give to our local community as things evolve. We do continue to be engaged in response activities. We're still doing testing. We're still doing outreach for vaccinations. We're still really paying attention and trying to do that educational component of the response. But as the volume of our cases is down, we're also beginning to look toward what recovery means. So taking stock of what other health impacts COVID-19 has had in the community is one of the first steps in that direction. That's something that we're beginning to do as we're not as busy with phone calls for contact tracing, case investigation, as well as other vaccination-related activities. And as things evolve and change, if the situation doesn't change all that much, I think I'll move to probably doing written updates for the board, with the understanding that if things do change and there is quite a bit to report out, I'm always happy to come back and give verbal updates as well. So really very glad to be able to give some good news to the group today. And like I said, it's wonderful to see all of your smiling faces this morning. So thank you.
Thank you, Grace. Any questions, comments?
I just want to thank you, Grace and Allison, both for your help in getting communication about these changes in CDC guidelines out to our staff. And I share your excitement about being able to see people's faces again. It feels wonderfully normal, and that's a great thing. So thank you.
I still worry that I forgot my mask.
We do have masks throughout the community now, so we got between the clinic and public health quite a few masks, and we do have drop sites throughout the community and have worked with the EDA and Visit Cook County to make sure they also have N95s available. So if we ever go back into that high transmission area, or there are people who continue to prefer to wear a mask, they are now freely available throughout Cook County, which is great.
It feels really good to be so much better prepared for any changes that might happen. So thank you for your work there in preparing us and helping us navigate through the worst of times here too. All right. Well, thank you very much, Grace.
Thanks, Grace.
Thank you.
Have a wonderful day, and look forward to written updates, even though we won't get to see you with verbals.
Sounds good.
Thanks, Grace. Microphone shuffle.
And then that moves us on to item 6 on our agenda, Director's Report. 6A is Staff Update. Svaleson.
All right. So we are very excited to welcome Tina Lottie to the Public Health and Human Services team. You approved her hire on the consent agenda this morning. Tina comes to us with a degree in human services and several years of experience operating an adult foster care home. So she has great experience working with older adults with disabilities in a community setting. We're really excited to be filling this position as it has been vacant for some time. The position was first posted when Beth Benson announced her intent to retire in October of last year, and vacant since Beth retired in early December. So really thrilled to have someone coming on board. Her start date is contingent on her ability to find housing, which is always a concern. But it sounds like she has some plans in place for temporary housing so that she can get started as soon as possible. And we've also in the past made some accommodations for a remote start, for people to start going through some mandatory trainings that can happen virtually while they're in that transition to the community. That leaves us 2 vacant positions that we're currently recruiting for, the first being the mental health worker position. This is a position providing community-based mental health services, primarily to adults. That was approved at the regular board meeting last week. And then we are also recruiting for an adult services care coordinator position. This is an anticipated vacancy when Lynn Wright retires from his many years of public service with the Public Health and Human Services Department in June. So we're hopeful that we can get someone in that position soon. Just acknowledging how long it's taking to fill some of these vacancies. Lynn, with his many years of service, has a rather large caseload, and we're hopeful to be able to have as much transition time as possible with him and someone coming into that new role. Some things that we did to hopefully widen the net of eligible candidates that we can recruit for that position is working with the Minnesota Merit System, which is a DHS service that oversees our hiring and personnel actions as a department, working with them to ensure that we're able to recruit qualified candidates who are eligible for the position either based on a background in social services or a background in nursing. So our internal position for Adult Services Care Coordinator is inclusive of both of those education requirements. Merit System would require us to recruit from two different pools, but we were able to advocate and work with them to ensure that we're able to bring someone in with experience, a variety of experience that would qualify them based on our internal position description. We haven't had a lot of experience or luck recruiting nurses for these types of positions. It's not unheard of. Allison Herron, when she worked with our department, was a public health nurse who provided care coordination services to seniors. So we do have some precedent for that, and you just never know who might be looking for a job, and we want to be as broad as possible. So first review of applicants will begin Friday for that adult services position. We also have staff participating in the ISD 166 Career Fair in April and are looking forward to that as a way to connect with students and adults who might be thinking about careers in public health and human services. So putting together some statistics from the Bureau of Labor on job projections and median wages and things like that to get more information out to young people in our community. I'll move on to agency updates, and this will be a good lead in, Commissioner Hawkins, to your questions around our subcontract renewal with the Sawtooth Mountain Clinic. We have recently learned that the SHIP coordinator at Sawtooth Mountain Clinic, Betsy Bloom, has announced her intent to retire from her position, so she'll be leaving at the end of March. You might remember that for 2021 and 2022, funding was committed to support bringing that position from part-time to full-time with the support of some grant dollars from the Department of Health to have some flexible response capacity for our work with the clinic. So for many, many years, we have worked with Sawtooth Mountain Clinic to contract out that SHIP program. This is a stable grant that we receive from the Minnesota Department of Health to support that position on a part-time basis. So with the upcoming transition of Betsy out of that SHIP role, we are taking a pause and looking at how to best staff that position. Does it make sense for that position to continue to live at the clinic, or would this be a time to consider bringing that part-time position back in-house? So I want you to be aware that we're moving forward and exploring that as we do whenever someone leaves a position or if there's a change in our contracted services, really taking a look at what is the best fit for this, the staffing of this position going forward. Something that we are exploring is having the idea of this part-time SHIP coordinator physically located at the community center. As you know, we don't have a surplus of space in our department right now. So one of the motivating factors for looking at that is facilitation of the connection between our work in public health and the work happening at community center and extension, particularly around nutrition access, family resiliency. Sarah is bringing a lot to her new role as extension, and we're really looking at ways to really capitalize on that partnership, and if there would be the possibility of having an integrated or co-located service of a part-time public health position funded by the SHIP program located at the community center. Sarah will also be bringing this as a tentative thing that we're exploring to her board later this week. So under items for board action, we have the request to approve or renew that subcontract with the Sawtooth Mountain Clinic for those additional hours for the SHIP position. We do anticipate, based on the fact that we're exploring how to best staff that position, the SHIP coordinator, whether it is at the clinic or the county, that we will have underspending in that grant amount, but we do need to honor the commitment to the clinic and the fact that Betsy, in her months of service in that position, has performed work under that grant for additional response activities above and beyond the SHIP work plan. So I'll just take a pause and open it up for any questions you have about the potential transition with the SHIP position and the subcontract that we have up for renewal to support the additional hours for the SHIP coordinator.
Yeah, when I heard of Betsy's retirement, clouds went over over my day, and I understand her situation and really happy for her, but just she was so new and exciting, I thought, in the position, so it bummed me out. But I'm really excited to hear, per usual, in your dynamic way of reassessing and looking at a good strategy. And I think that's very exciting with Sarah's position at the community center, and just trying to integrate that position more into our community and just bringing those values, better partnerships, and where it's housed. So I'm excited. I'm very excited about that. Do you have questions about the consent agenda?
Lots of questions, but it's still going around my head, sorry.
Well, okay. Well, I thought maybe specifically about item F, the subcontract.
Yeah, because the contract is, it says for COVID-19 public health education, and we're talking SHIP, and I'm trying to reconcile the difference here.
I can speak to that, Commissioner Hawkins, to say that the intent of that additional subcontract was to support increasing the SHIP position. So we are contracted with the clinic and have for many, many years to provide funding for a part-time position. Andrea Orest was in that position most recently. When Andrea transitioned out, Betsy came in. While Andrea was in that position, we worked with the Public Health and Human Services Board to secure additional funding to bring that position up to full-time. At that time, we were in the midst of the Delta surge and busy and really relying on additional support from Andrea in her role as SHIP coordinator to do a lot around volunteer management, nutrition supports. She was spending a lot of her time above and beyond her part-time SHIP position supporting our overall public health response.
Yeah, and I apologize. Obviously, I didn't do my homework. So I remember the agreement that to increase the SHIP position, and it was COVID related and there's more work. I get that. But what is in our agenda for today is a contract with Sawtooth Mountain Clinic for COVID-related activities. That's the 4 bullet points here, which we did have a contract that was a 6-month contract for that same thing that expired in December. And I thought this was replacing that contract and not the SHIP contract was different.
It is a different contract, but the funds are going to support the person in that SHIP position. To
fill it out.
To bring their hours from part-time to full-time.
But
one
this doesn't
person
say that, so
working under.
I prefer, because I go back and read things later, and it doesn't say that. I have concerns about that, I guess.
So you're concerned that this contract doesn't specifically say it is the other half of the SHIP position?
Yeah, because when did we do the SHIP position? We did SHIP $43,637, and the contract goes through October 2022. So why do we need to do?
This
I'm
is
just
the other
really
half.
confused. No, this was, we did this November of 2021 for the, I'm sorry, I'm just really confused on the dollar amount. And I apologize that I obviously didn't do my homework well enough.
The SHIP position is a regional grant through our community health board, so that's the reason for the funny grant period. It doesn't perfectly align with the calendar year. The reason for having an additional subcontract that doesn't explicitly say SHIP in it is that it's not tied to the SHIP position. It's that it's two different pots of money that we're using to support one person at the clinic.
And what this resolution in here says, outreach and basic education due to COVID-19, answering basic COVID-19 questions, assisting in coordination of COVID-19 drive-up testing, participating in community-based public health initiatives from COVID-19. And I guess I question, do we really need another half-time position? We have 3 people in our public health department now, and now we still need to contract for somebody at Sawtooth Mountain Clinic to do the exact same thing when we have one case?
I would
I would lean on that 4th bullet point quite a lot. That's, I mean, we don't even.
Well, then I would like to see it laid out. I want to know, we have childcare issues that are causing child protection issues. We're having lots of other things going on in our community because of COVID-19.
Mm-hmm.
And $31,000 to print more, I'm just questioning this.
Well, I would say it's all connected. It's all related. The family services issues related to COVID, this position's other half trying to better support family services around COVID response and recovery. I don't think we're overdoing it. I think we're going to be reeling for quite some time because of recovery.
Totally understand that. I agree. Mental health issues,
Yeah.
childcare neglect.
Yeah.
Yeah, I get that.
Yeah.
I just don't know that this is the best way to go about dealing with those issues. I mean, we sat through, 3 meetings in the last few days. Everybody has their little, I need the money for this, and we have this problem over here. I don't know, if I have to make a decision on $31,000 based on what I see written out in front of me, no, I guess I just don't see, I need a better roadmap of who's doing what and what is it actually costing us. Because $31,000 is a lot of money that I think could be used for other things that can help with pandemic issues in our community right now. That's my opinion.
I guess I would push back that other things is a little more nebulous than this even. And, I don't know if we need to get into those nitty-gritty details, but I have a lot of confidence and respect for the department in coordinating with our other community partners on how best to address this. So if you have like a specific plan or ideas that are not being addressed, I think we should talk about those, but I don't think we should halt our department's operations because there might be other opportunities.
Well, this goes back to last month. We talked about an organizational chart and wanting to see, because we have had turnover, who's where and who's doing what. I guess I'm still confused. So.
Yeah, that'll be I think we should put that on next month's agenda and just talk about the organizational structure, like the flow chart would be handy, or maybe that's the wrong word, flow chart. I like charts. I like images. It'll help, and it'll help the whole
We'll get you a
board.
pie chart.
Yeah, well, pie charts are good too, maybe not in this case, but Pat, you had your hand up as well.
Well, I just wanted to say how excited I was about hearing. I understand your question, Commissioner Hawkins, but I was really excited about seeing this position transition to the community center. As someone who's been very involved in what goes on there and very involved in the nutritional needs of what our community needs right now, I think having Sarah Waddell's organization and this person working together side by side is going to make the whole process much more efficient, and we're going to provide much better service to the people who really have the needs, and it's going to be much easier for them to come into that space and express their needs and get their services rather than come maybe here. So I hope we can figure this out and it can work there, because I just see pluses all over the place. And from what I hear when I'm on the Public Health and Human Services Board, every person in Allison's organization does a myriad of things. No matter what the job description says, they're doing other things as well. And I think that's what's going to happen by co-locating these two positions. We're going to get more bang for the buck, more bang for that $31,000, because they'll be able to see the need and figure out how to work it much more efficiently. So I hope we can answer your questions, Commissioner Hawkins, and this can go forward, because I see pluses much more than not.
So, I'm sorry.
Please go ahead.
May I? So, Commissioner Hawkins, did you attempt to speak with Allison before this meeting to get more information about this item?
No, I was just reading what was in my board packet.
Okay, that's been available for some days now. And I guess I'm curious. I mean, these kinds of issues keep coming up in these meetings, and it feels to me like there's a performance going on here, and I'm not sure who the audience is. But, you know, first of all, these are budget expenses. And we keep having these conversations at this dais that suggest that something nefarious is going on here. And that bothers me a lot. It really does. It creates an atmosphere of distrust. And it signals to the public that somehow we are doing things that we shouldn't be doing. And that's simply not true. So, you know, I would like to suggest there's a better way to do this. I mean, if you need information about agenda items before meetings, I would suggest that you contact me or the department director, and that we get that information for you so that you don't have this uncertainty when we're in the meeting.
And I often have things that come to mind during the meeting, so I think I understand where Commissioner Hawkins is coming from, and that is definitely a much better, more effective approach. And I still want us to be able to raise these questions during the meeting, but
For
when...
sure. And I'm not suggesting that you know.
No, your point is well taken there. Well, to me, at least. Commissioner Hawkins, you had your hand up.
And I apologize that I didn't reach out to you, because I really didn't think this was going to be a big issue. I really didn't. And it has nothing to do with a performance. I do not do anything in this position to put on a performance. I am doing my job, asking questions, making sure I'm responsible with taxpayer spending. That is it. When I looked at this report, we approved subcontract with Sawtooth Mountain Clinic for public health response and recovery. SHIP didn't even enter my thinking. And so when you gave your agency, and I'm like, wait a minute, what did I read? What did I do wrong? This is where I just want to make sure. The public, I'm sure, didn't think SHIP either. So I just want to make sure when we put things into our board packet, it's a complete, I shouldn't have to keep digging for answers so I can vote on something. I don't think. I want a complete explanation of what it is. And I apologize. Really didn't think I thought it was going to be an easy answer, and it's not. And I apologize that I wasn't ready for it.
Commissioner Svaleson?
Is this going to be used for SHIP?
No, it will not be used for SHIP. The way it's currently staffed is that the SHIP coordinator is working additional hours under the subcontract. Given the transition with SHIP, we may or may not bring that position up to full-time or continue to fully fund that position.
So this is not used, this is not going to be used
That's
as
correct.
being approved today for SHIP?
That's correct, yeah.
Yeah, I am confused as to why you're confused.
I apologize.
No. Yeah, I see this just as the other half, and that's what we approved when we did have the conversation in the past. With maybe an equal amount of discussion. So I don't think there's any, like, there's no, in my mind, there's no confusion with SHIP here. This is separate, as Commissioner Svaleson, I think, was pointing out, but. Well, I'm sorry for your confusion as well, Commissioner Hawkins. We don't want to have things be murky or cloudy or confusing. We'd like them to be as straightforward as possible, and it seems that way to me, but it's not for everyone, so I apologize for that. So, all of that being said, despite some confusion, is there, I'd still entertain a motion to do this addendum with the master contract.
So moved, Mr. Chair.
Thank you, Commissioner Sullivan. Is there support?
Support.
Thank you, Commissioner Svaleson. Motion and support. Any further discussion? My only other request or ask would just be if I can better understand your concerns and try to get those answers. Although it's not entirely clear to me what further information you
I'll
need.
work on it.
Okay.
I
Okay.
promise.
Well, I don't doubt it. Commissioner Sullivan.
Yeah, I was just going to say, there are times when, and I'll just give a recent example, where I was preparing for a planning commission meeting, and I had lots of questions, and I wound up contacting Tim Nelson and Neva Maxwell, and tried to do that a couple of days in advance, so I had time to make sure I had all the facts straight. And so I think just, reaching out and getting information from our staff here, they are so knowledgeable and do a great job of explaining things, does really help.
Just want to apologize. I usually do that. And Alex and I have sat down together previously. I skipped the last time, but I really didn't think this was an issue for me at that time. Sorry.
And I'm sorry for any frustrations, James, that you feel or Allison in the organization. In our roles, well, whatever. There's just a lot, and it's not for
me.
well, no, I'm often in a similar situation with things that come up in meetings. Our approaches are different, but it's similar, and yeah, everyone works differently. But I just really appreciate your willingness to address questions that we have, and trying to work through this and help clear things up. So.
Well, and I think we're all working together as a board. I mean, today you talked about changing the proclamation to we rather than I. And I think we as a board sitting here want to all be fiscally responsible, and we all want to do the best for our county. And so that's where I see, we are a team, we work together, we have our bumps along the way, but we do good work. And I appreciate this team and what everyone brings to it.
Yeah, the different perspectives do a lot.
And Mr. Chair, I would agree with that. And I just want to be really clear. I was not at all intending to discourage anybody from asking questions. That is your job, in fact. And it's our job to provide answers. But I would hope that we can work together in a way that builds trust within our organization and also within our community in the work that we're doing together.
Yeah. Practice makes perfect, huh?
We hope.
All right, that's all the discussion, unless someone has anything else. All in favor? Aye. Opposed?
No.
Motion passes 6-1. We also have item for agenda 7A, the approval to hire mental health worker, a crisis responder. Allison.
Yeah, happy to give some additional background on this request. This is a request to move forward with the necessary steps to hire a mental health practitioner within the Public Health and Human Services Department. We will not be posting that position until we've gone through all of the necessary steps with Personnel Committee and job evaluation. We do have the job description on the Personnel Committee agenda for this afternoon and anticipate job evaluation taking place in the next week. But what we're seeking today is your support in moving forward with the necessary steps in hiring this position within the Public Health and Human Services Department. This is a 2-year pilot that's supported with federal dollars through the American Rescue Plan. The allocation for the 2-year pilot was approved by the Board of Commissioners late last year. And we have secured funds through the Regional Behavioral Health Initiative to offset the cost for the 2-year pilot. One of the barriers for moving forward with the contracted purchase of service agreement as planned is HDC's wage structure. They have a very low starting wage for a mental health practitioner level position. It's essentially $18 to $19 an hour, which would be comparable within our CCEA wage structure to a $130, which is a clerical position. The work that we're asking this individual to do is very autonomous, independent, working in the community with people in highly stressed crisis situations. Our estimate is that this will be graded at a 160, which is comparable with a mental health worker position that we are currently recruiting for. And that starting wage is $23.49. So again, we want to ensure that we're able to make good on the commitment to our partners, to the community, and to the board in being successful with this 2-year pilot project. Throughout the 2-year pilot, we're committed to continuing to seek out funding to support and sustain this position. We have a number of opportunities, including billing for the service, and that is a component of our contract with the Human Development Center is to provide both the clinical supervision that's key to being able to bill for that service and the technical assistance involved in learning all of the components of documentation and billing on our fiscal end to help sustain that service. We did meet with HDC on Friday to discuss. They remain committed to providing that clinical supervision and working with us to achieve certification to bill for the service. We've also met with our local partners, Sheriff Svaleson, Kimber at the hospital, Jackie at Grand Portage Human Services, and they are all in support as well of hiring this internal to the department rather than contracting with HDC to staff and supervise the position. So no anticipated levy impact for the 2-year pilot, and we'll be committed to drawing down funds to support this position in 2024 and beyond.
Very exciting, and want to applaud your coordination here too with all parties involved and hearing about other programs, as we've talked about in the past, that are happening in the region. There's some good examples of the successes there and the impacts. And just anecdotally hearing from the Sheriff's Department too, just the potential with this is going to be very helpful. So, I mean, almost like a 2 or 3 birds with one stone kind of scenario. Maybe that's a bad analogy, but at least I didn't say 4.
Yeah, no throwing stones.
In the glass houses. Yeah. Any questions for Allison here?
I have a comment before we open it up for questions.
Please.
Just to say, I know that there are still some outstanding questions about our organizational chart, what this means, the addition of this position in-house, the changes with public health service delivery. So we will bring an updated organizational chart to the Public Health and Human Services Board next month to illustrate this is the current state, this is where we're headed with the proposal that I outlined last month of looking at reorganizing our children and family services units, so that more information to come next month, along with a more well-defined ask of what we're looking to do and moving forward with that shift.
That'd be great. And even if you can even if you want to spitball stuff too for like other ideas, much like the kind of the ship transition or anything else, I think it'd be really helpful just for us just to know, what opportunities there might be, what other things we should be thinking about, or what other things you might see potential for, if there are beyond that. I mean, there's plenty already to put on a chart. So, but just want to invite that if like don't hesitate to brainstorm there, please. Any questions for Allison, this position? We did talk about it before, so I don't know. And then we will be going through personnel, so I'll get to talk about it again. Commissioner Sullivan.
Mr. Chair, I'd like to move to approve to post the mental health worker crisis response position pending our personnel committee review and job evaluation.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I'll second.
Thank you, Pat. Motion and support. Any further discussion? I heard something. I
wasn't going to say anything, but I'm going to just say, again, I don't like the way this happens. Not saying I don't appreciate the position or
the process.
But it's the process.
So how do you see it different? How could it?
No other department gets to get something approved and then say, we are going to do all the work on it later. It goes through a process and it's approved by the board.
I think it's still going through the process.
It's just the order of the process, yes. That's just my concern.
Okay. Like, it's important that we talk through things and address concerns. And I think I understand it. Mm-hmm. And what you're saying is you would rather it go through personnel, get the job evaluation, and then come for our approval. Is that what you're saying? See the job description,
yes.
Okay.
I guess that's what I prefer. That's the way it's been done. That's what I prefer.
And
personal.
And how I see this is us giving the go-ahead to start the process, is how I see it. Instead of starting the process and then giving the final say, this is like, okay, let's start the process. Because right now we could be like, no, we don't want to go down this path, versus, and there's a lot of weight put on the personnel committee with this, but I'm sorry, go ahead, Rana.
Well, this is as I said the last time, this is the group that understands the needs and the capabilities of that type of staff. I don't know that the personnel department has that understanding of what's really going on with it. I mean, I'm pretty new, so I don't know, but that's just a thought that this is, this has been well researched. We discussed it at our PHS advisory council already and talked about details, and so it's been through a lot of things of these are the needs, this is how we could meet the needs, this is maybe how we could fund it if we need to find extra funding, and then so that, to me, that is the process. I don't know how it would possibly be helpful to skip that.
Commissioner Svaleson.
I think I understand Commissioner Hawkins' issue, and I see your point. You've helped me with this because last time I was a little bit wrapped up in it. This group looks at it from the technical need, the need of the community, that type of thing. Commissioner Hawkins is pointing out that this is a separate and distinct board from the County Board of Commissioners that approve hires for, the county. It might be better, this is just, I'm thinking through this, but it might be better when we have things from the planning committee or others, they make an approval with a recommendation to the Board of Commissioners. And that might be what you're actually asking for here, to keep everything in process. You're asking for Public Health and Human Services to approve this going forward, to go through you know,
Personnel.
the Personnel Committee, and then come for final approval to the Board of Commissioners. Does that,
Thank you.
well, I think, that I mean, your point is correct. In
No, but, yeah,
procedure,
I'm trying to-
the Board of Commissioners do the approval for hire for all county positions. And I think that's what Commissioner Hawkins is telling us. By bringing that to this board, you're taking that out of, even though we have the members here, process-wise, you're putting it into a different committee for making the approvals. But from what you said is absolutely true. The planning committee looks at all the planning issues and all the things and then says, we approve this, right? And they have that ability to approve that, but it ends up being a recommendation to the Board of Commissioners to make that final approval. Are we in the same spot? I'm asking. It kind of feels like that's where we're at with this. The only additional thing with this and what kind of twists up people is you have the same members plus some additional folks
Right.
in here. So although we may have the ability to do it process-wise, Commissioner Hawkins is saying, it still should be a recommendation to the, you know, the board so that it goes through personnel and then comes to that committee. And then process-wise, everything lines up and you're good.
Yeah, I think the difference is we, as a Public Health and Human Services Board, do have statutory authority.
That is true. That's a difference.
Yeah, and so it gets confusing.
I was just looking for a process way to get us back in where everybody was on board.
Yeah.
Allison,
If
please.
I may, I think one of the factors is that the Personnel Committee meets the same day as the Public Health
Yeah.
and Human Services Board, so just logistically.
And I understood that.
Yeah.
But I was trying to find a way to get all that to kind of line up here.
We should just meet before 8:30.
Well, and we have just one meeting a month, the Public Health
Yeah.
and Human Services Board, which is
Yeah.
a factor as well.
Yeah.
And the reality is that we're working with a real acute need for resources
Yeah.
and lots of layers of policy and bureaucracy, which are important to be accountable for public tax dollars, but add a lot on the side of coordinating, especially a service like this that involves a great deal of coordination with community and regional partners and contracting. So my aim in bringing this forward is to not to try and sneak something in or get away with something. I'm aiming to be really transparent about what it is we're trying to achieve with posting this position and moving forward with contracting. You will absolutely have the opportunity to review and approve that job description and the contract with HDC for supervision.
Well, and as we said before, we've already approved this position, you know, so, yeah, it's one of, this one's even a little more twisted than the rest, so.
No wonder I get so confused.
And
But-
I dream of the day when we don't have to meet the acute needs, you know, if we can, but it's just so, but I'm also so grateful for your willingness to meet those acute needs and how we can, so yeah.
But anyway, Mr. Chair, there is a motion and a second on the floor.
Is that where we're at?
That's where we're at, just as a reminder.
I appreciate all help. Any further discussion here? Seeing or hearing none, all in favor?
Aye.
Aye. Opposed? Motion passes 6-1. And that moves us down to, thank you, Allison, and board. That moves us down to our committee reports. And before we get into those, we don't have a whole lot of time, and we missed last month's. Are there any, so in the past, Commissioner Storlie, you had requested we kind of take the NACO off of this area, is that? No? Oh, okay, I
No,
misunderstood.
ARDC,
Oh,
Arrowhead
Which is
Regional,
the
that
same,
has
but
nothing to do
completely
with the
different.
Health Committee. I report that at our board meetings.
Right.
Keep NACO on, that's
oh,
that's a
okay,
big
I'm
deal.
sorry, because, yeah, and you're on the Health and Human Services at
Right.
NACO, yeah, okay, that's why I was confused. So the request is to take ARDC
It's
off,
already off,
okay.
yeah. I suggest we wait till next month, this is getting too, you know,
For updates?
yeah.
Oh,
it's getting
okay.
too late,
Okay. Okay.
unless anybody
Yeah.
has anything special.
Yes,
Yeah.
I do.
Rana,
Because
please.
You know, the Public Health and Human Services, the local mental health advisory council met last week and of course the month before. And we talked about this time of year is difficult for people emotionally. That's been a long winter. And we talked about suicide survivor group or some more resources for the community, because that is an ongoing consideration. And there is one of the resources that Andrea found was Suicide Prevention in Indian Country virtual presentation on March 24th at 6:30. And we think that's going to be very interesting and helpful for people here. And also, Allison, did you have some other resource on that topic?
Yeah, one of our members of the Mental Health Advisory Council is James Zimmer, who's a behavioral health consultant at Sawtooth Mountain Clinic, and he is going to be hosting a virtual event at the end of April around suicide prevention with a focus, I believe, on veterans as well, and speaking from his lived experience in the military service. So we'll ensure that's noticed on the next agenda as well.
Okay. And I think some people have been attending workshops and getting information, and there's a lot of things ongoing about that to try to keep the high level that we have for meeting people's needs.
Mm-hmm. Thank you for sharing that. Anyone else have a pressing update?
No, Allison gave mine for active living.
Yeah.
And I appreciate that.
And that's also one through the CHB too, so it's a blow there. But okay, well, in that case, it sounds like we have consensus to move to again postpone the committee reports, and that moves us down to adjournment. Motion to entertain a motion to adjourn. Commissioner Svaleson, is there support? Thank you, Commissioner Hawkins. We are adjourned.
Gonna keep going.
Yeah, there you go.
Oh, and I can sign these things now.
So you've had a nice visit with the Grands.
Reports, but do want to
Great
thank
you
all
could
of
do
you for
that.
taking attendance at the child fair.
Absolutely.
Yeah.
We're so glad we could be
Really
part of it.
demonstrated support for this as a critical
And
need.
so it was great to have.
It's certainly needed.
With the meet here and Michael and his new partner.
Yeah, I think